If something is not documented, there is no proof that it was completed.
I like to be educated, but I'm so frustrated.
We would like to take this opportunity to welcome you to Caring Help, a place where nurses learn how to successfully navigate the complexities of the healthcare system and break the barriers that limit their success. I'm Benis Odudu, a certified nurse educator by the National League for Nurses. I work with newly graduated and immigrant nurses to help them advance their career, get over the cultural shock they experience on the job, and build their confidence. In this episode, we will discuss how new graduate nurses can enhance their documentation abilities. In the field of healthcare, documentation is an extremely important component. It requires the recording of patients' information as well as care plans, assessment, and interventions by experts working in the healthcare industry. When it comes to guaranteeing patient safety, providing continuity of care, and keeping medical records, the quality of nursing documentation is absolutely essential. Why keeping accurate records is essential? One, nursing documentation is essential both legally and ethically to keep current medical records. This requirement stems from regulatory requirements. It is absolutely necessary to comply with the regulatory standard to document the treatment that is provided to patients and to shield healthcare professionals from legal risk. The documentation helps to detect any gaps or discrepancy in care as well as giving evidence of care that was provided. It facilitates communication and collaboration. Having proper work that is both accurate and up to date is absolutely necessary in order to successfully enable communication and collaboration among healthcare providers. It enables nurses to share information with other members of the healthcare team, such as physicians, therapists, and other healthcare professionals, which in turn enables them to provide continuity of care for patients. 3. It enhances the quality of care. Proper documentation is essential to ensure that patients continue to receive high-quality care. It plays an important role in ensuring that the requirements of the patient are satisfied and that interventions are successful. The documentation that nurses use to record patient evaluation, vital signs, medication, treatment is a crucial part of providing quality care. 4. It helps in research and analysis. The recording of nursing care is an essential part of research and analysis in the nursing profession. It offers a foundation upon which to evaluate patients' outcome and find patterns in the provision of medical care. In addition to this benefit, nursing documentation assists in determining areas in which there is room for improvement in terms of patient care. 5. It helps in billing and reimbursement. Absolutely necessary to have accurate paperwork for the purpose of billing and reimbursement. It offers a record of the service that were rendered, the medications that were given, and the equipment that were utilized. For healthcare institutions to be eligible for reimbursement from insurance companies and other payers, they are needed to maintain proper documentation. As a new graduate nurse, here are 5 strategies to improve the effectiveness of your nursing documentation. Use of standardized terminology. Making use of standardized terminology such as the nursing process and NADA, International Nursing Diagnosis, can assist in ensuring that the documentation is consistent and appropriately reflects the care that the patient receives. Guys, we all learn this in nursing school, right? This has a pattern to enhance communication and comprehension among medical personnel, which in turn can support quality care. Its timeliness and accuracy. The document should be completed as quickly as possible after the care has been provided, and it should be timely and accurate. This guarantees that the information is correct and accurately reflects the patient's state of health at the current time. The documentation must also be legible, using language that is clear, concise, and easy to understand, to guarantee that the content can be understood without difficulty. You absolutely want to receive credit for the tasks you provided, and documentation is the only way. 3. Inclusion of relevant information or pertinent information such as assessment, intervention, evaluation should be included in the documentation. This can help support continuity of care and ensure that all health professionals involved with the care of the patient have access to the information that is accurate and current. Accurate documentation could relieve you of the burden and anxiety involved in finding out if a task was completed by the previous nurse. As nurses, we all know how sometimes relevant information are missed, of course, during handoff, right, guys? 4. Familiarize yourself with technology that can support good nursing documentation, such as computerized physician order entry system and electronic health records. Systems such as this may help guarantee that documentation is readable, correct, and completed in a timely manner. It becomes easier for healthcare workers to communicate with one another about the care of the patient. 5. Participate in education and training programs for documentation that are offered by your healthcare institution. This will ensure that you understand the significance of efficient documentation and that you have the required skills to complete documentation in an accurate and timely manner. This can also help guarantee that you are using the same terminology throughout and that you are adhering to established documentation standard. Guys, it is crucial in the field of nursing to have accurate nursing documentation in order to support patient safety. Communication and collaboration among health providers and delivery of quality care, and act as evidence in the case that there are any legal concern. Guys, it is crucial in the field of nursing to have accurate nursing documentation in order to support patient safety. Communication and collaboration among health providers and delivery of quality care, and act as evidence in the case that there are any legal concern. As previously stated, if something is not documented, there is no proof that it was completed. We appreciate you watching. Please be sure to subscribe, share, and like the video, as well as turn on the notice for when new videos are uploaded. You can also contact me via the email displayed on the screen. But remember, a caring heart makes a difference. Thank you.
I wish I knew